Hello, my name is Lisa Decker, and I'm a postural alignment specialist through Egoscue Institute. And today we're going to be talking about an exercise called Diva Pose. This exercise is also used in many other methods. I've heard it called the 90-90 stretch. But I use Diva Pose to really go after the ability to rotate the femur. The femur is this big leg bone, your hip joint, okay? And we want our femurs to be able to rotate in internal and external rotation. So this is going to ask for a lot of rotation of that joint under a stable pelvis. So if you have hip degeneration, I would probably stay away from this exercise for now, but it can be a great exercise to really promote the rotation of the femur. If you have knee pain in this exercise, probably means that the femur's not rotating. So in cases like that, you may need to use this as a functional test and find other exercises first to get better rotation of that femur bone. As I always mention, in every exercise, it can be used as a postural exercise to restore posture and alignment, or as a functional test to assess the current function of your body. So for this exercise, you're going to want to sit on the floor, and we'll start with the right leg out in front, okay, and the left in back, okay. And you want to have the knee kind of at about a 90-degree angle. From there, you're going to sit up, and you're going to try to get this left hip down towards the ground. You're going to keep your lower back in extension, meaning that you're rolling your pelvis forward. You're not leaning back, okay? From there, assess and ask yourself, what do you feel, okay? So this is asking for a lot of external and internal rotation of the femurs, okay? So it's asking for both. Now, where this becomes a great functional test is to switch sides. And as you switch sides, ask yourself, is one side more difficult than the other, okay? And that's a great way to test your function. Is it easier to get one hip down than the other? This is a great exercise, like I said, to promote femur rotation on a stable pelvis. Now, if you're having a really hard time getting into this exercise, one way to get it to loosen up is to take the knee of this right leg and lift and lower. Okay, now try to keep your pelvis stable, but lift and lower. And what that will do is begin to get some rotation and movement into that leg joint. Okay, these are called diva lifts. Another way to do that is diva presses. Press the knee down into the ground and relax, down and relax, down and relax. And that often will get the femur to loosen up in the joint, the hip to loosen up in the joint, and you'll feel that butt cheek come down to the ground more. Again, all exercises are not good for all people, and exercise is only as good as the body you bring to it. So you can use this exercise as a functional test or to restore posture. For more information, go to my website at alignedfit.com.